Hi, Ben.
Hello.
This is Ben Schwartz, who's a marriage and family therapist, and he's going to talk to us today about what he does. So he uses a technique called EFT, or Emotional Freedom Technique, and why don't you tell us a little bit about what that is?
So it goes by different names, but officially EFT, or Emotional Freedom Techniques, is what has the most research behind it, and you'll hear that name quite often. And some people use a variation of that technique and just call it tapping, or meridian tapping. It's more of a generic term for the same basic technique. And so it's based on acupuncture, and I know you're an acupuncturist, so you relate to that very well, except that you don't use needles, and what you actually do is tap. You can tap on another person, but normally you're tapping on your own body on various points as you focus on something that you're holding on to emotionally or mentally, or even physically, that's somehow locked in the mind or body and you can't let it go. So it's wonderful for trauma of any kind. It's good for phobias, it's good for anxiety, it's good for any obsessive thought, or just anything you're trying to let go of.
Great.
Yeah.
So how might someone struggling with fertility issues benefit from using EFT?
Yeah, that's a good question. And the basic answer is EFT, or tapping, is really good for stress of all kinds and for trauma, like I said. And it's very traumatic to go through experiences around infertility for most people. Most couples go through a tremendous amount of turmoil, trying to conceive, failing to conceive, talking to all their friends and family about trying to have a baby and getting their hopes up and then getting disappointed repeatedly, and it takes a toll. It creates a lot of stress, and it creates turmoil also in the relationship, which then in turn can create more stress as well. And what we all agree on is that stress causes all kinds of problems, even physically. A lot of illnesses are more stress related than any other factor, really, I'd say, that influences illness is stress, somatic problems.
Absolutely.
So because we're talking about fertility and reproductive organs, which require everything to be working optimally and with lots of good blood flow and all of that, that's not compatible with a state of stress. And stress, all of our main internal organs are protected, but everything else, like reproduction and our extremities, blood flow decreases. That's why you get cold hands when you're under stress and anxiety. So the idea is to release all that emotional stuff and help people to be positive and relax and have positive expectations without a lot of anxiety and stress, so that they're more likely to conceive.
How about, can you help with couples who maybe have been through some traumatic experiences regarding multiple miscarriages, multiple rounds of IVF?
That's a big one. The example of someone who's had miscarriages and is trying to conceive again. You know, people don't always realize how traumatic that is when you think you're going to have a baby and you have the beginnings of a life inside of you, and lose that. You've already developed an attachment to that and an expectation, and that's a huge loss, an emotional loss. So